Good evening, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam, and this is COVID World News. I have two special guests who are members of the API. I have Shankara Sanka and Ratna Sanka. They are both doctors, and they have been working with API COVID group. And today we are going to be talking about COVID-19 pandemic. Let me start with my PowerPoint presentation, and we'll go through this one. Now, first, we're going to be going through a series of slides, trying to highlight some of the things that we would like to discuss in this 30-minute presentation. And then I will have my guests make their comments, and we'll go from there. As you all know, this COVID-19 has been going on since the beginning of this year, and Triple N Media has done a lot of work in educating the public and also providing a lot of information about the COVID-19 pandemic. First, we're going to start off with the world statistics. As you can see here, there are more than 7.2 million people all across the globe who have been infected with the coronavirus, with 412,000 deaths. And the interesting thing is more than half of them have recovered from the coronavirus infection around the world. And here's a sort of an interesting and disturbing chart, I should say. And here's the graph of the United States, where it shows there was a sudden rise in the beginning of March, and then it has slowly come down, but it has not reached the bottom as we would like to see. This is as of June 9th. Brazil is a hotspot right now with almost 739 cases, and it's just steeply climbing like it's trying to reach Mount Everest. It's the same thing with India, and we'll talk about India as what's happening and why cases are going up in India. United States, UK, even though it had a pretty big upstroke and a lot of number of cases with acute corona infection and deaths, still they have been able to manage to get their number of cases down pretty nicely, like similar to a familiar bell curve or the FOR curve, as we call it, to represent the rise and fall of any epidemic. And here's Canada, which also has shown a sort of a smooth curve that you would expect to see in any type of epidemic or a pandemic. Now we are going to look at the number of new cases in the world on a daily basis. And here you can see on the chart, around April 1st week, the world new cases count came up to 100,000, and it has pretty much stayed the same until about March 20th, and from there it has started to go up. Right now it is hovering around 125,000 new cases per day all across the globe. Now we're going to look at the death chart. This is for the whole world. The good thing is after April 15th, the number of deaths on a daily basis have gradually come down to about 4,000 per day. All right, so let's move on. And here is like a composite chart. It's pretty busy, but I'm just going to highlight on a couple of points in this particular chart, which will be of importance as we discuss at the end of our slide presentation. Here's the United States with more than 2 million people who have tested positive. And in the United States, we have almost 19,000 new cases each day. And as you know, we have more than 112 or 115,000 deaths. The United States has done 21.2 million coronavirus tests. That's the highest number when compared to any other country in the world. The other country I would like to focus would be India. As you can see, India numbers are creeping up very rapidly, I should say. It's almost past a 250,000 number of cases. Now the death toll is almost 7,200, and India has done 4.6 million tests. Okay, and then Iran, I'm going to talk about Iran with reference to what's happening in Iran, because that may have some relevance as to what is happening in Texas. And I have a slide I will emphasize on that in a minute. And here, if you look at United States, the numbers we are talking about, 2 million cases with 114,000 deaths, and about 700 and about a third of them having recovered from the coronavirus infection. And here's the graph which is showing the number of new cases. At least in the United States, the number of new cases is decreasing compared to the world chart, which is going up. Next, we're going to look at Texas, the state of Blue Bonnet, and also Alamo. I see you got your Alamo in the background.
Yeah.
That's nice. So Texas, the state of Blue Bonnets, and here we have 78,000 coronavirus cases and a total death of 1,892, which is considerably less compared to most other states in the United States itself. And if you look at here, more than 2/3 of the people in Texas have recovered. All right, so let's move on to a couple of interesting things I want to bring about. Here are 3 different charts from New York City. This is the number of new cases after the epidemic broke up. And here we have a nice, what is called this bell-shaped curve, where you have a rise and a plateau and a steady decline. This is for the new cases, and we have a similar pattern here for the number of deaths. All I'm interested is just looking at the pattern of the waves, and here are the hospitalizations. These hospitalizations, again, there was a steady rise in the number of patients being admitted to the hospital, and during the peak time, they had about 1,800 new cases per day. Then it has, quite nicely come down. Let's keep this particular chart in your mind, because I'm going to compare this to a different scenario. And if you look at Texas, this is what's happening in Texas. The new cases started somewhere along March 12th, but we don't have a steady upstroke. We don't have a plateau, and we don't have a smooth decline. But what we have is like lines scattered all over. And we are talking about almost 3 months into this epidemic here in Texas. But still, we have these numbers going up and down. And here's the date, April 26th, when the first phase of opening up of the economy was introduced. And on March 30th, we had the second phase, which was put in place. And the numbers keep going up. In fact, the numbers in the last 2 days have gone up. And we're looking and see, what may be causing these. And to compare that, I put a graph from China and also from Wuhan, where actually the coronavirus pandemic started. And here they have a pretty smooth upstroke and a plateau and a downslope. The interesting thing is it takes twice as long for the curve to come down as it takes for it to reach the peak. So we need to keep in mind. So first of all, we don't know if we have reached a peak in Texas, but then after that, we have to decide how long it's going to take to come down. If it's taken 3 months to reach the peak, then you can imagine it may take twice as long to reach the bottom as we see here. Here are the new deaths. Surprisingly, the number of deaths in Texas have been considerably less, no more than like 30 to 40 cases per day. But still, we don't have like a typical bell curve. Or maybe we can say that we have taken such good care of quarantine and also lockdown. The graph we are seeing may be a flattened pattern of a curve, which we don't see in New York and UK and other places. So it may be like a flattened response, which may be good. When we flatten the response, I think I may have a chart there. When we flatten the response, it drags on longer, and it takes longer time to reach the peak, and it takes longer time to recover. Another interesting point is that towards the end of May, the number of or the percentage of people who were testing positive for the coronavirus was like 4 to 5% of the people. If we tested 100 people, 4 to 5 people may be showing positive coronavirus, but now it has gone up to 7%, showing that there has been an increase in the number of actual cases given the same population who were being tested before and now. That's an important thing. And I talked about the hospitalization. Let's look at this New York City chart, and let's look at Texas. This is a Texas hospital chart. The number of people in the hospital on any given day. And as you can see, this is the beginning of April, and this is June 10th. It has been steady for the last 4 to 6 weeks, around 1,600 or so. And in the last couple of days, it's well over 2,000. And actually, this is more than what we had in New York City as such. But of course, New York City is different from Texas State. Today, they had like 2,100 plus cases in Texas hospitals. That's an important number to keep in mind and see what we need to do. Okay, I also want to talk about the American Association of Physicians of Indian Origin, API, which has been kind enough to have Dr. Sankar and Mrs. Sankar be on our talk show program and talk about what's going on with the coronavirus. And more importantly, maybe I can ask both of you as the role of API in terms of the coronavirus crisis, in terms of education, in terms of providing support to the community, in terms of helping people who might be stranded or things like that. Would you like to comment on that?
Yeah, I'll take. I think we'll split the call on this one. API has been pretty proactive about supporting both aspects of this: the physicians, the clinicians, of course, with a lot of webinars that they're organizing with a lot of stalwarts in our own organization, and they've held Zoom conferences, webinars of education of various aspects of the coronavirus with the pulmonary specialists, the cardiology specialists, the neurology specialists, and trying to give us more information on the front lines. On the social aspect, I think they've done a lot with a Donate a Mask program. I think they had launched, where they had gotten in touch with N95 suppliers, and we had, as a group, found people who needed masks, and API as an organization has donated a lot of masks to the frontline people. And last but not the least, I think they also launched a nursing support program, which is still ongoing, and to the nurses in most of the COVID units across the country. I think API has supported providing them with lunches, with support, with PPE. And I'll let Ratna talk about what the prescription program help has been like from API.
So the API also has a COVID helpline email. There have been a lot of families who have been stranded in US. These are parents or families of people people who were living here, and because of the stoppage of the airlines and travel, they have stayed here and they have been unable to get their necessary medications, and they do not have a local physician or even a local insurance to be able to fill those prescriptions. So they have been reaching out to the Indian consulate, and Indian consulate in tie-up with the API, we developed a group of physicians who are volunteers, and we are reaching out to these families, trying to figure out what prescriptions they need, and also helping them find good resources without insurance on getting all those prescriptions. We also have a telehealth tie-up with Capstone that can offer telehealth visits for people who have any illnesses or any questions about any of their health, either health illnesses or their medications. So we're trying to keep them on their medications and healthy without stressing the already stressed healthcare system through these helplines.
Absolutely right, because there are so many family members who come here. They can't leave home, they can't leave town, they can't get on the plane because there are no planes going cross countries. It's a great way for the API to help with all these life-saving necessities under these circumstances. So is this the best way to get www.opusa.org?
So they have the information on the RP website with the free clinics and the discounted clinics. And we also have an email, which is, I think, available on a couple of other slides. And the email is pretty simple. It's COVID helpline at rpusa.org. It's a pretty simple email that we have come up with. And you email us with the information you need. Our physicians get in touch with you, and we walk you through the process of getting prescriptions locally with local volunteers in each state.
That's very good. So ladies and gentlemen, if you're watching this video and if you have any concerns about your medications or medical visits or anything like that, you can just visit the rpusa.org website, and there you can find all the information. In fact, someone on the Facebook had posted, I have to go to India in 2 weeks. Is there any way I can find out the information? And here's a little US Indian Embassy website I have put here. They can look at it. And that actually tells the number of flights that are going to India from different parts of the United States, and what are the requirements and stipulations. And I also found out that even if they get on the plane today and go, they will be on 14-day quarantine no matter what. So that's an important thing for them to keep in mind. Okay, let's proceed with I want to look at a couple of slides about India. Then we'll talk about, because they all sort of fit in the same category: India, Iran, and Brazil, Texas, because they're all sort of in the same basket. So that's why I want to put some of these slides. As you know, India almost passed 250,000 new cases with 7,000 plus deaths. And let's look at this graph here. This is going pretty steep. And if you look at the New York graph, when you see this peak, you don't know where we are. We could be somewhere here, we could be somewhere here, or we could be here, but we are not sure as if we have reached a peak unless we see successive declines in the number of cases. Given the Indian population of 1.38 billion, you can say, well, 10,000 cases per day is very small. So by looking at this, the so-called flattening of the curve, maybe we have been successful in reducing the number of cases, because if they didn't have a lockdown of any sort, that number could have been in like 100,000s or millions, who knows? Obviously, those numbers would have been pretty high. So given this fact that they had a lockdown for almost 6-8 weeks, the curve, even though it looks steep, but the total number of cases is very small compared to the population size. And same thing with the deaths. Deaths are in a much smaller range as such. And this is the Houston chart, which has drawn sort of national attention right now with this big like media news headlines. Texas passes 2,100 new cases, new hospitalizations for the first time. So yes, a lot of you might have heard it, and we'll talk about that. So this is the Iran chart when on the 11th they lifted their lockdown, and there was a gap, but then they had a pretty significant bump. So that's something we had to keep in mind as we watch the Texas graphs for the next couple of weeks or 2-3 weeks. Now, we'll just brainstorm for the next few minutes about just give us an overview of what is your take on this coronavirus pandemic here, particularly in Texas and in India. And then we'll talk about, how effective was the lockdown in these places and what's happening, especially to the Houston and San Antonio and all these other areas in Texas, and what do we do going forward? So you both can, take.
Okay, so we'll go with the first question. I think the impression of the corona pandemic, I think it is real, of course. It's, I think, about time we all realized it was real. We got a little behind on the bandwagon. There was mixed messages from WHO. I think we all came together now with the lockdowns the way it happened. I think Texas did very well. I think we are blessed with the fact that the state is a little more spread. We're not as dense as a population. I think we flattened the curve. And like you said, as we flatten the curve, it's going to last longer. Now, is it gone? Is it over? Are we going back to work?
Well, I think opening up was probably an economic decision that everybody took because of what was going on. And because we have flattened the curve, I think we have spread it apart. I don't think it's gone. I think it's here for a while. So I think we need to make enough adjustments and open up in a slow, restricted fashion where we still take all the precautions that are necessary for us to be able to protect ourselves and keep the curve flatter. Unfortunately, that will mean that it will be spread out farther, but I think we still need to take the precautions and slowly open up.
The next question we have here is, how effective was the lockdown in Texas or in India?
So I think for both, I would say the answer is they were very effective. I think Texas has not gone the New York way. We have not gone the Illinois and the New Orleans way. I think we have surprised the country with how flat our curve has been, how well equipped and how effective we were in managing our hospital population. I think the same thing has happened in India too. I think we'll compare both at the same time because the lockdown in India has been extremely effective. And the challenge is going to be how do you reopen India without seeing the peaks we're having? Like you said, we don't know which part of the curve we're in.
Yeah.
So that's a very big challenge for the Indian hierarchy.
Yeah, here's the chart of India. As you said, we are right here. It's hard to say. We even if you say it's flattened, we don't know where we are. Whether we are here. And it's just a matter of time. And I think it's going to take much longer time for India to really reach a peak and then reach a plateau. And beyond that, it will probably take equally longer time or maybe even longer to get to the end of towards the bottom of the bell curve. Okay, let's talk about the hospitalization numbers, which is of little concern to me. Let me bring up the chart. Okay, here's the number of hospitalizations, which actually is like more than what it was in New York. Of course, that was New York City. It was not the whole state. But 2,100 plus hospitalizations, and this is nothing that jumped up today or yesterday, but it's been sort of steady around 1,700 for 4 to 6 weeks. So what do we make out of this?
I think we are seeing definitely the numbers are higher, and which is very concerning. And I think these are directly related to us partially opening up. And unfortunately, not everybody may be following the social distancing. That's one question. Are we getting complacent with our social distancing? Is that the reason? The numbers increasing is partly because we are testing more, and we are also doing more testing in high-risk areas like nursing homes or more group homes or the jail. So we are seeing more numbers, and I think if they are high-risk group, there is always a higher chance of hospitalization for more prevention of needing a high acuity level of interventions. Though we are seeing more hospitalizations, we are not seeing the high acuity hospitalizations. Yeah. So we are identifying them earlier, and we are treating them earlier with our remdesivir and some of the protocols that all the hospitals have for treating some of these patients. We are not seeing as many deaths, which is a good thing. So it is concerning, but everybody is monitoring the stressors. There is a health system stress level that is being monitored closely, which looks at the beds available and number of testings available, and access to ventilators and ICU beds. And those are actually looking good. Our stress level for the healthcare system is in a medium level, and we are not high. So I think this is concerning, but I think we are still optimistic that we're not going to see the peak. Do you have any other ideas?
No, she's absolutely right. We see patients in the hospital. The acuity of the cases is lower. I work in a hospital that is our COVID hospital in San Antonio. We have about 4 COVID units in our hospital. And the number of cases have increased, but the acuity of the cases, the number of ventilators, we do a lot of ECMO procedures in our hospital, and those have decreased also.
That is true. As we can see in the chart here, it says, the ICU beds like 1,500, but they are using only like 15% of the ICU beds in Texas, which the governor had set a limit of 16 as a threshold. for increasing demand on the healthcare system. As far as demand on the healthcare system, I think Texas is pretty well positioned to even see if there is a spike in the number of acute cases or the number of patients who need a hospitalization and all this. I think the medical center is pretty well equipped, not only in Houston, in Dallas, and also in San Antonio, other places. The main thing is what direction is this curve going, and if it if it turns, as I said, if some of this is related to the mitigation rules that most people are not following, it will be similar to the Iran graph I showed you. So the Iran graph I showed you. So we are going to see all these numbers, but probably it's not going to last for 3 months or 4 months, because if someone is gotten infected, within 2 to 4 weeks, most of that should reflect in that period. And hoping maybe the next 2 to 4 weeks may be an important period to watch and see what happens to the number of cases. Like in the case of Iran, I mean, if it starts coming down, that may be a sign that we not only came over the first initial hump and Texas opened up twice. We opened up twice. And so a slight increase is expected. And hopefully, that will sort of settle down and hopefully see the beginning of a downturn in these bell curves. Okay, let's look at, we talked about the hospitalizations and, we talked, what do you think is happening in India?
It's a double question. I think they will have to open up because it's almost going to be the same situation that we had in the US. It's a balance between economy and health. The challenge is going to be the maintenance of the social distancing, availability of masking. It's just a very dense population, so it's not very easy for them to do. The other challenge also is how much testing is being done and how much is being reported. So the final question, I think, the scary question, which I'm the ever optimist, I think they do, but do they have the infrastructure to handle a peak, which
in fact, going to the last question here, what do we expect as we go in the future? Here's an important, very, very useful chart. I'm going to go over this and then we'll sort of conclude as, what we think needs to be done in the next 4 weeks from a medical point of view in order to keep those numbers down and hopefully turn the tide around. Here's New York State. They're looking at the infection rate, which is like 0.77. That means one person is able to infect less than 1%, whereas in Texas it's 1.1, which is pretty good, I should say. And the next thing is the number of people who show positive when they are tested. Ours was like 4%. It has gone up a little bit. This is a little concern, but this was expected because when you open up the economy, more people are going to work. Some workplaces require people to get tested, and we are going to be exposed to more people. And in fact, that is going to show an uptick in the number of tests. And sometimes, what has happened is they are not only getting tested for the virus. A lot of these people are getting tested for antibodies, and they're putting both in the same basket, which is sort of confusing the whole issue. You're not supposed to be putting the people who have already recovered from the virus in the same basket as people who have an infection. And so there were some questions raised about that. So now they are starting to separate those numbers for people who had antibodies, which should not be in the same basket as those who have active coronavirus infection. And we talked about the ICU bed demand and supply. And an interesting number is contact tracing. So in New York, they were only able to trace 11%. And they had like 500 volunteers to track these people who test positive to see, they quarantine themselves and then track the people they have come across to trace these contacts. They were going to increase it to 1,000 people. What can we do here in Texas? I mean, if we have like 4,000 or 5,000 people testing positive every day, where are the resources to really do the the contact tracing.
It's easier for smaller countries like Singapore, South Korea to do it.
Yeah.
I think practically impossible for big places like us.
So let's summarize and say, now we know where we are. We know what to expect going forward in the next 4 weeks or so. What is the best thing each person can do? Maybe we'll just brainstorm and put it out, and hopefully maybe people will get useful information as what they can do as far as keeping themselves from getting infected, or if they already have a virus, keeping everybody else from not getting infected.
So I think the rules are already in place. I think we beat people up with the same rules, and I think they apply. If you're high risk, we avoid places of congestion. Elderly people do need to avoid public places as much as possible. When you're outside in a public place with many people, it's encouraged to mask and to maintain your social distancing. We will have to go back to work. I think everything will open, and I think we still have a choice. And people who would like to go out, we hope they practice the good technique. People who are scared, we expect them to maybe just not participate if they're not comfortable.
And if you have an infection or any signs of it, get tested early. I think the key to controlling is early testing and availability of more testing, and quarantining yourself if there is any slight suspicion of an infection or any symptom, and contact tracing. I think along with the social distancing and the safety precautions we are following, we also need early testing, contact tracing, and quarantining to help control this disease. Unfortunately, it looks like it's there for us for a while, but we need to do all these to control it.
Absolutely. I think, you highlighted all the points that we as individuals have to do. I always keep saying, if you want to be alive, you got to take charge of your life. Nobody else is going to, protect you from getting a coronavirus. Only you can do yourself what needs to be done to protect yourself from getting exposed to the coronavirus. From a state level, I think at least for the next several weeks, contact tracing and identifying people with the infection and quarantining them, and then working on people who have been exposed and try to keep them off the workplace, so that the 80% of the people who don't have virus should be able to return to work and carry on with their work and keep the economy going, so that we have the best of both worlds. In fact, their numbers are going to go up, and those numbers are going to take some time to come down. As long as it just doesn't, just get totally out of control, that's when we're going to be worrying about. We didn't even talk about the strike, which is also going to add to perhaps the number of new cases. That's something we just have to wait and see. Any final thoughts?
No, you nailed everything. We hope everybody is in it and everybody has a role to play. I think people staying home are doing their jobs. People going to work carefully are doing their jobs. And we appreciate you having this forum for people to understand what the ins and outs of this disease process is.
Shankara and Ratna, thank you very much for being on COVID-19 World News. I am Dr. Nik Nikam for N Media, and we will see you next time. Thank you so much for joining us.
Thank you.